So, hello everyone. Welcome back to the module on rodent neurosurgery. In last session, we gone through how to perform euthanasia, and the next important session that usually follows euthanasia is the organ harvesting. It's very important to know how to retrieve the brain and spinal cord intact. This session is very important in two ways. One is obviously to know the technique per se as to how exactly it is done, and next thing is how neatly it needs to be done, how delicately it needs to be handled. I mean that's why the entire session has been dedicated for this. I mean from a dead animal any organ can be retrieved using 100 techniques, but then the right technique is one which causes the least amount of damage to the organ that you are going to harvest. More so important for the organs like brain and spinal cord, because once the implantation is done with any of the sensors or any drug delivery cannulas, any of those sort of implant is done, usually you need to confirm it with histopathological slicing and to show where exactly the piercing was done and which is the target that has been looked at, whether you really hit the bullseye for the target, and see whether any sort of histopathological changes that have come across. So, in order to preserve the entire architecture of the brain or spinal cord, or for that matter any organ, it is very important that you take out the organ from the body cavity as neat as possible with with minimal damage. So, there are some techniques which when performed as per the procedure that are described here in this session, you will not only get a nice and clean brain spinal cord, it is also quick. Alright. So, in a short time there are techniques which can be used to retrieve the organs. So, generally most of the time it is brain with other organs. So, for the want of time and trying to remain within the scope of this module, we are trying to limit ourselves to brain and spinal cord. I recommend you all to go through the literature for retrieval of other organs which are relatively easier compared to brain and spinal cord. So, only brain and spinal cord will be covered in this particular session. So, there are two things. Now, if you look at the outline of today's talk, we are trying to discuss how do we harvest individually the brain and the spinal cord. Another important part of today's session is if at all your experiment needs the coverage of both brain and spinal cord, the technique is slightly different. Alright. So, first we will go through the individual organ harvest from brain and the spinal cord, then simultaneously we will see how it can be done. So, coming to the mouse brain harvest, I have taken an example of harvesting the mouse brain, which is a relatively common small animal to be used. If at all your experiment involves rats, the major difference is going to be the skull, and of course, the size wise is relatively bigger. The major difference is going to be the thickness of the skull here. As you can see here, the rat has been totally skinned out. I mean the skinning is done wherein the skin is peeled off. What has been shown is the skull, the entire skull with eyes and ears. So, the point that I was trying to highlight here is the relative transparency of the mouse skull bone. So, that is the reason why it is easy to harvest the brain from the mouse as compared to the rats. Rat, it might require a little bit of bone ronger handling, but relative steps can be followed. But if at all you are not able to use the scissors for the rat, a drilling technique can be used, or you need to use a little sturdier instruments to harvest the brain. You all can see how even the brain surface capillaries are seen through the skull. So, a rightly performed technique, it is pretty easier to master this technique, and it's very vital that you follow and understand each and every single step. Of course, there is a learning curve involved, as I have been telling in other sessions as well, but once you master it, it is a cakewalk indeed. Alright. So, the instruments required, I have listed out only the most important instruments that are required. So, the other instruments are of surgery, which are anyway we have discussed in detail, they are there, but specifically the straight scissors are the workhorse of the harvesting surgeries. Alright. So, this is used to cut the skull, divide it, and even expose the brain. Tooth forceps obviously to handle the skull which has been cut by the straight scissors, and then lab sampling spoon. So, this is very important. If you have this, it becomes pretty easy to detach the brain from the base of the skull and then scoop it out of the skull cavity. Alright. So, before we go through the surgical steps, I suggest all of you to go through the skull anatomy a little bit. I am not covering the anatomy again here, because we have dealt with it quite in detail in last few sessions, the anatomy of the skull and the spinal cord. It is very important that you remember the bones of the skull, which we are going to handle it in today's session, and plus as to what are the attachment that comes near the base, in the base of the skull. That is also pretty important, because separation of those structures are important before you take the brain out of the skull cavity. Alright. So, let us look at the surgical steps one by one, and then I will show a video video to demonstrate how exactly all these steps comes together in harvesting the brain. So, as I said, as a first step, the skin is stripped off completely, starting from the upper neck. Alright, this is the body. So, from the upper neck to the nose, the skin is completely stripped off until the eyes are exposed completely, so that you are going to stabilize the nose area of the skull with the forceps. So, that is pretty important, because that is where you are going to give the fixation. It is really difficult to use the stereotactic apparatus for the fixation when it comes to harvesting. So, there are many techniques where the head is decapitated and then you are going to do all this, but after having gone through many techniques myself, I suggest that you maintain the head with the body so that it becomes easier to handle the rat, and you have many more tissues to use it as the tethering points for you to handle the skull and then harvest the brain. Alright. So, let the animal be intact, at least the skin, muscles and everything, which will give us some tethering and some fixation, so that you can easily perform the skull stripping before you take the brain out. Alright. So, once the skin is stripped and the subcutaneous tissue is exposed, the entire intact skull has been exposed here, and you stabilize it with the tooth forceps using the nasal bone there. Alright. After that, a very important step is to ideally separate the foramen magnum, alright, from the atlas, that is C1 vertebra. If you all remember the skeletal system anatomy, we have atlas, axis and so on and so forth as cervical vertebra. So, craniovertebral disjunction. It is difficult to use decapitation because we are handling the skull bone and the vertebral body straight. We are not really cutting the entire skin, and it does not really fit into the actual definition of decapitation procedure, because we are stripping the skin, moving out the soft tissue and exposing the skull bone here, after cutting to the muscle, and then do a craniovertebral disjunction. So, we are separating the cranial bone from the vertebral skeletal system. So, that separation is very important to expose the occipital area. If you remember the anatomy, you have a frontal bone, parietal bone, interparietal bone, then comes the occipital bone, which actually fuses with the atlas axis. All right. So, this is the communication of the brain there, and it becomes the spinal cord down. So, if your experiment does not need to, there is no need to harvest the spinal cord, you can follow these steps wherein you are doing a craniovertebral separation. And then it is very important that you get an access to the cranial cavity, because there will be a hole which is called foramen magnum. That is basically magnum means bigger, foramen means hole. So, that is the bigger foramen where the brain continues down as a spinal cord. So, that is the whole idea of using it. So, once the separation is done, the next step is to pass the straight scissor, which we just discussed. The tip of the scissor is being slid into that hole that you have created by cutting the skull from the vertebral body. So, once, and it is held vertically that way, all right. So, you pass it along the sagittal suture. If you all remember the anatomy again, you have this coronal suture, sagittal suture, and this is bregma, and that is lambda, all right, and that becomes the lambda there. This is lambda point and lambdoid suture, coronal suture, sagittal and bregma point. So, that is the skull bone. After you cut the separate the skull from the vertebral body, this is where you are introducing your scissor. So, that is the sagittal suture that forms the bregma. So, you are cutting the sagittal suture, and it is easy to separate the skull bone along the suture lines. Rather than cutting the intact bones, not only damages the the skull bones, and of course, and it tears off the surface of the brain, and the whole purpose is defeated. So, you need to maintain a jelly like structure intact while you are stripping off this tough skull bones covering it, all right. Once you pass it vertically and separate the sagittal suture, you need to flatten the scissor, all right. So, once you flatten it, and you open the scissor so that the parietal bones falls apart, it opens like a book. This step is very important. You go straight in and then give a 90-degree turn so that the flat surface of the scissor lies against the brain, and then you open it up, all right. So, that causes very minimal damage because the surface is pretty smooth, and then that opening force not only separates sagittal suture, there is another separation happening laterally, all right. If you remember the side profile of the skull bone, there is this temporoparietal sutures as well. This is just on top you have sagittal suture, this is temporoparietal suture on the side profile. So, it has to break on the lateral sutures as well, so that the bone falls off completely, all right. That is pretty important. So, that the majority of the brain comes into view in this step. Now, the only bone left will be the frontal bone, which is covering the anterior part of the frontal lobe and then the olfactory bulbs, all right. So, once you separate the parietal bone and the occipital bone with that step, so now what is left is this part of the bone and the brain. So, you continue with the similar step, taking care not to pierce the jelly like brain underneath, all right. Now, you have a little more leverage where you can use the lower prong of the scissor to give a gentle lift upward and then slide the scissor over the surface of that sagittal vein. There is a vein here, and there is no brain tissue there. So if your study is okay to injure the vein, you can sort of take the advantage of that to rest the scissor on top of it and then cut the remaining part of the sagittal suture. All right. It is the same step that you are repeating for the remaining part of the skull. Once you slide and cut the central part of the sagittal suture, you turn it again. So it is the repetition of the first phase of the steps for the remaining part of the bone. So cut, turn and then separate, what is shown here, so that the flat surface lies on the brain. Once that is done, the remaining part of the skull opens up and you have a full intact brain in view, and you have a smooth glistening surface. It is called pia mater. Then you have arachnoid. On top of it you have dura mater. All right. Then only comes the cortical grey matter of the brain. So it is very important you maintain at least these layers. Dura may or may not be maintained, but it is alright if it is not maintained. Alright, if it is maintained, then it is perfect. If it is not, it is fine, because whenever you strip off the skull, the dura is adherent to the under surface of the skull. That usually gets ripped off, but it is alright. As you can see, there are no vessels. So obviously during the skull removal, the dura along with the venous sinuses is gone with the skull. Alright. So the entire brain comes into view. So if you have noticed, this grip is being maintained throughout the surgical steps that we just saw. That is very important, because during the separation of the skull, if this moves, you are going to damage the underlying brain. So once that is done, then you introduce this spatula, which is the drug sampling spatula, and then you insert it in front of the olfactory bulb and you give a tug posteriorly. That is very important. Backward tug, what will happen? For example, if this is the brain from the side profile, it is attached to the optic nerve and there are multiple vessels which goes above, alright, from the circle of Willis. Circle of Willis is basically the arterial arcade vessel, and this is the side profile of the skull and the brain. You are introducing the spatula on top that way. So this is the sagittal profile of the same step that I am discussing, and then you are giving a tug backward, this is called posteriorly, so that this tears. This entire thing is torn. Olfactory nerve, the optic nerve, and then the blood vessels, all which is at the base of the skull is torn, and then it moves forward. So backward. So once that movement is achieved, you know that it is ready to be lifted off from the skull cavity. If you do not do this step, the under surface of the brain is going to have laceration, because the tethering elements of optic nerve and these vessels are going to pull on the structures below, and then maybe the lower half of the brain will get damaged. So the whole idea of all these steps is so that brain is preserved as much as possible for you to do slicing, clear slicing, and all the structures can be studied in situ, that is as it is, alright. So that is pretty important. And then you pass this same spatula under the surface of the brain, that will take care of the remaining part of the tethering elements from the base of the skull. Once it is done, then it can be served on the petri dish, and it is completely taken out of the cavity and removed. So that is the entire surgical step. If rightly performed, if performed correctly, it should not take more than 10 to 15 minutes to harvest the brain. In rats, as I said, it may take bit longer, but if you can use a bit more heavier scissor, you can still cut the skull bones and spread it across to harvest the brain. So now let us look at the surgical video which demonstrate the same process as I just explained in those steps. So in front you are seeing the fixation that is there, and then you are cutting the middle of the skull using scissors and then flattened it, and now the separation happens with a flattened surface against the brain surface, alright. So, there is a complete separation of the sagittal suture and the entire brain comes into view, and then there is a break along the lateral temporoparietal sutures as I said, and then it is completely folded across. Then the similar step is continued. You can see a vertical slit given, then the scissor turned and then it spread across, alright. Then you introduce the spoon, give a tug backward, that direction that will tear off all the structures, then it passed under the brain to get it out of the skull cavity. See, that is the entire surgical steps in one video wherein the mouse skull has been handled. So, it is pretty easy to harvest once you master these principles and techniques, alright. So, that is the video for those are the surgical steps required for harvesting the brain. So, now if you done some spinal cord study, for example, we discussed how the spinal cord contusion models can be used, spinal cord implantation can be done with various implantations of either a drug delivery cannula or microelectrode. So, various implants can be done, and again you need to study the histopathological changes related to those implants. Then again you need to remove the spinal cord intact. It is very important that the surface of the spinal cord is intact, because most of the histopathological analysis involves the surface grey matter and of course the deep white matter. So, spinal cord being so thin and slender in these small animals, getting them out intact is pretty challenging. So, obviously what we do not recommend is to open the complete skeletal system, drill each and every cervical vertebra. So, that is definitely not recommended, because in the process you are going to destroy this thin and slender spinal cord that is within the rigid skeletal system. So, I suggest strongly that to follow these techniques that we are discussing today, then it is going to be really smooth and easy, and then you will get a pretty intact spinal cord for histopathological analysis. So, there are two ways of handling the spinal cord harvest. The first part I am going to explain the surgical step wherein spinal cord is removed separately, after removing the skull. So, what you are seeing here is the entire vertebral column starting from the first cervical vertebra to the lumbosacral junction, alright. So, if you all remember the discussion, the cord ends around T13 to L3 level, L3 to L4 level the cord gets terminated, that is, if it goes and becomes tapered and then you do not have any more cord, but the skeletal column continues as tailbone, if you remember the anatomy that we discussed, and that is how the brain will be, alright. So, you are cutting it at the C1 level, and then you need to cut it at lumbosacral level, wherein the entire length of the cord is covered. So, that skeletal separation is done, and then you do one more separation along the lateral edge, wherein the entire rib cage is cut in the thoracic junction and you remove entirely the skin and muscle. So, then you are left with the spinal column, skeletal spinal column along with paraspinal musculature, alright. So, this much you will have to do it before you harvest the spinal cord. So, that part of the discussion I need not cover, because it just you need to go on cutting it. After you make these two cuts, you need to remove the entire tissue which is below and above the spinal column, and it is just basically you are trying to dismember all the other skeletal structure, alright. So, once you have the spinal column along with paravertebral musculature. So you have a block there, alright. So you have two openings, one opening towards the cervical vertebra, that is C1 atlas, and then one opening which was in continuity with the rest of the body, that is sacral hip bone and the hind paw. This will be close to the forepaw, and that is the head. So you have separated from here and you are separated from the sacral body. So you have two holes there. What you are doing is to pass the syringe cannula into the lumbar segment of the opening foramina. Okay. Let me clear this for you. So you need to remember, the spinal cord is not just a thin tube inside, it will have attachment as these cervical roots, lumbar roots. If you remember the anatomy that we discussed, all the roots would come out and form the peripheral nerves, alright. So that is the central nervous system and the peripheral nervous system that we discussed in the last session. So it is very difficult to expose all these roots, expose all the cord segments, and then you cut it in a microsurgery fashion every single nerve. So the best way of handling this in a small animal is, and there is an advantage that it is thin, small and slender. If you put a hydrostatic pressure using the saline from the lumbar foramen, basically the spinal canal, you are trying to pass the fluid under high pressure using your a syringe there. With the piston you are going to push the saline into the one part of the spinal canal, that is the lumbar end of the spinal canal. It is going to sever all the roots because of the pressure, shear pressure within the spinal canal, and this is the cord is going to get extruded out of the cervical foramen of the vertebra. So in the first part of this surgery you are going to have this block where there is two opening and there is muscles, alright. You are going to pass the saline using a syringe and you are going to thrust the fluid force the fluid into the spinal canal. Once that happens, the roots are going to get cut. It gets avulsed from the spinal cord. Fortunately, it does not really cause a major damage because these roots are getting torn, and plus they are very thin and slender, does not really affect the architecture, and then the spinal cord is going to get extruded out of the spinal canal. So that is the whole principle behind this particular surgery, alright. So what you are seeing in this picture is the same. You are trying to fit in the cannula into the lumbar foramen, and with your other hand you are going to stabilize the spinal canal using the forceps, alright. So as you can see, when the force is introduced from one foramen, the spinal cord is getting extruded from the cervical foramen. Like a white worm, it is going to come out of this particular end of the spinal canal, and the entire cord without any roots is going to get extruded out, and plus the entire architecture is getting maintained with this particular step. So this particular technique is the most preferred technique, wherein you are going to get the intact spinal cord without any additional damages, alright. So this is the video which is showing the entire step which I just described. So introducing into the spinal canal at the lumbar end, and then you are trying to push the saline into the spinal canal. You can see how the spinal cord is getting extruded from the cervical canal. So that beautiful slender thin spinal cord is maintained completely in its structure, and then with a fine needle you just separate it out of the spinal canal. So this again, once you master it, it is a pretty simple procedure to harvest the spinal cord. So next comes a little bigger challenge. What if you need an intact brain and spinal cord for your histopathological analysis. So these are important in some of the circuit studies, wherein if you want to sort of look at the the tract that starts from the brain and then which goes right down into the spinal canal and the spinal cord, then you really need the intact central nervous system to analyze. For example, if that is the brain and then you have the spinal cord, if your study has some circuit studies wherein, if for example motor cortex pathways, it descends entirely from the motor cortex down into the spinal cord. If you all remember the circuitry which we discussed in one of those anatomy sessions, then if you are trying to look at the histopathological analysis, you probably have to do multiple slicing and throughout the pathway, then you need this intact brain and spinal cord. For example, if you are trying to disfigure this and this end of the spinal cord, then you probably would miss out many important slices which are required for your histopathological analysis. So these are some of the pretty special scenarios where you would require an intact brain spinal cord to be harvested. So how is it going to be different when you need to harvest the brain and spinal cord? So basically we are going to combine both the set of the surgical steps which we discussed for the brain and the spinal cord with some modifications which need to be done in order to get the intact brain and spinal cord. So the first step, as I said, you are going to expose the skull, alright, and then the upper part of the cervical vertebra. That is pretty important, because as I said, so here that has been done. The entire skull and the upper part of the cervical musculature has been maintained, alright. Once that is done, you bend the neck of the animal so that the cervical vertebra comes to a little more superficial position. That is pretty important to expose the foramen magnum, alright, and the C1 vertebra. That is the foramen magnum and C1 vertebra, wherein all the muscles that are supporting this craniovertebral junction is separated. All the muscles are separated and the bone is exposed, alright. Once the bone is exposed, then you dislocate it, complete craniovertebral disjunction is done, craniovertebral separation is done, so that the upper part of the spinal cord, that is cervical segment of spinal cord, and the lowermost end of the brain, that is cerebellum, will be seen from this view, alright. So this is pretty important. Once this is done, next what you are trying to do is to separate the foramen magnum area, dissect it out a bit more, so that the entire neural structure of craniovertebral junction or cervicomedullary junction. So this is the skeletal junction, this is the neural junction, cervicomedullary junction. What has been exposed here is the cervicomedullary junction. I mean, though the terminology looks little too much, it all means that the lowermost end of the skull and the topmost end of the vertebral column. It is easy to feel that wherever the skull is ending, that is the occipital bone, that will be the interparietal bone. Once you feel the surface of the skull ending, and then you will feel the vertebral bodies going in rings, that is where the junction is. At that junction, you will have to dissect it bit and then remove the skull bones on top of it. It might require drilling in the rat, but in mice you can cut it with scissors and remove those bones there, so that this white glistening neural structure is exposed. So once that is done, you will do the complete skeletal separation, and now it is easy to lift up the skull bone once this separation is done, alright. So from here onwards, the steps for the brain harvest becomes similar, alright. Once you separate all the skull structures in the neck area from the vertebral body, there is a big gap that can be felt by the positioning of the neck, wherein you have bent it, and then you lift up the dorsum of the skull bone. Then the entire process that we discussed for the brain harvesting is repeated here. Alright, so this is pretty important. Separation of the cranium from the vertebral system in the intact animal. Alright, you are not trying to dismember here, you are not putting the scissor across, which you normally do it for just brain harvesting. Alright, you are just removing the top part. Let me go over it again just to be clear. This is the sagittal section. What I am showing here is the sagittal section. For example, if this is the vertebral bodies and this is the skull, you are removing only this part of the skull and the vertebra, so that the brain and the spinal cord is visible from top. That is very, very important to understand. You are only removing the dorsum aspect of the skeletal structure, expose the bone, and then you pass the instrument and hold it. Then you give a upward lift, so that you will get good enough gap between the brain surface and the skull bone to pass the scissor. That is what is being shown here. Alright. So then the entire surgical steps has to be repeated what we discussed. You pass it vertically, separate the sagittal suture, turn it by 90 degree, make it flat, and then open it up. Entire brain comes into view except for the anterior part. Again, that will be continued with the same step of passing it vertically, rotating it, and then opening it up. And then the entire brain harvesting step is repeated there, except that you are not going to pass this spatula here and then you are not bringing it out. You need to wait for the spinal cord for it to come out, and then only you are doing that particular step. Here you, in this particular brain and spinal cord harvest, you are just opening it up and expose the brain completely and maintain it until you finish the spinal cord harvest. So after the step of brain exposure, you are stopping it there, and then your attention is diverted to the lumbosacral junction. Alright, you just handle craniovertebral junction, that is the junction between the head and the neck, where you have exposed the brain, and now you are coming to the hip bone part of the animal, that is the hind limb. Alright, so that is the area that has been exposed here. Near the hip bone, you are opening up the skin, and once you retract the skin, you will see the spinal column in the center with the musculature there. Alright, so that is the lumbosacral exposure. That is very important. Then you go on cutting the paravertebral junction, paravertebral muscles. You have to cut it and expose the spinal column, that is the skeletal system. So here the paravertebral muscles are cut and those are exposed, and what you are seeing here, this glistening structure, is actually the lumbosacral junction. That is, you have this spinous process going in, if you all remember the anatomy. So here you are making the separation and you are bending it, so that the neural structure and the spinal canal, which is within the skeletal system, is coming into view with the spinal cord in its place. Alright. So you bent it, the straight spinal column is bent here, so that the foramen or the spinal canal comes into view. That is the hole through which you are going to pass the syringe that we just discussed. Alright. So it is basically opening a bottle both on top and the bottom, and you are trying to thrust the saline into the spinal column, so that the spinal cord comes out of the cervical end which you just exposed. Alright. So then from here onwards, the steps are similar to what we looked at the spinal cord harvesting. So once the lumbosacral junction is cut and then it is bent and the canal is exposed, you are passing this cannula into the foramen and then you send the saline under high pressure. Alright. You send the saline under high pressure, you can see that is the hole of the spinal canal, top end of the spinal canal, which will be atlas or even for that matter axis, does not matter, as long as you have the upper part of this spinal canal being exposed. You can see that once you thrust the saline, the entire spinal cord is going to come out through this foramen and you have an intact brain and spinal cord ready to be harvested. Alright. So, then you will have, then you need to repeat the step that what we did for the brain harvesting, where you are going to pass the spatula in front of the olfactory tubercle and give a backward tug, so that the tethering elements from the base of the skull is severed or separated, and then you can harvest the intact brain and spinal cord out of the cavity as shown here. Alright. So, this is the spinal cord which has been harvested by sending the fluid under high pressure, and once you pass it, you will get the brain separated from the base of the skull and you have the entire intact brain and spinal cord ready for histopathological analysis. So, that has come to the end of this session, where we have harvested brain separately, spinal cord separately, and also intact brain and spinal cord with all the architecture being maintained. So, that is very important. Alright. So, obviously you will be there will be some need to harvest organs like heart, lungs for chemical analysis, or even for that matter systemic toxicity analysis. You will have to collect some blood as well. So, I recommend for you all to go through some literature for those steps. This being a rodent neurosurgery session, we have covered the brain and spinal cord. Alright. So, if maybe we probably even cover some histopathological analysis as well, and in the next session we will try and look at some of the behavioral setups that are required. We will try and cover the stroke part of the behavioral setup, and then Parkinsonian model, which are the two popular models and most commonly used models in the nervous system studies. Alright. So, thank you all for kind attention.